Yeah, thank you. Okay, so I'm going to go ahead and share my screen, and we're going to go ahead and get started with the presentation. So again, I'm going to just go ahead and introduce myself and give you a little bit of background information about me. My name is Tracy Cook. I am the lead instructor in the dental assisting program, and I also work in the dental hygiene program. So we're going to hear a little bit more in this presentation what the difference is between a dental assistant and a dental hygienist. So if you're not familiar with that, we'll be going over that shortly. I am a dental assistant, or I was a dental assistant. I went into the dental assisting program right after I graduated from high school. I was a dental assistant for 10 years, and then I became a dental hygienist. I've been a dental hygienist for 23 years. And so I've been in dentistry for quite a while. I love it. It's always been fun for me. I was in a situation when I graduated from high school where I was in a pretty much kind of a homeless situation. I got kicked out of my home right after graduation for not following the rules. And I was on my own, and I ended up getting into dental assisting, and it was gave me the opportunity to provide for myself. I was able to get a car. I got my own apartment, and it just provided financial security for me. With the high demand in dental assisting right now, the company Neighbor Care Health that we partner with are offering $5,000 bonuses currently for students that graduate, or even before they graduate, to work for their organization. So you can ask more questions about that. In the meantime, I'm going to go ahead. Again, I'm Tracy Cook, and I have been in dentistry for over 30 years, and I'm enjoying it. The dental assisting program is located in the Pacific Tower. It's kind of like the big Gotham building that's on Beacon Hill. We are not located on main campus. So what does a dental assistant do? A dental assistant provides patient care. They work chairside with the dentist to treat patients, take x-rays, polish teeth. Dental assistants can get in all kinds of specialties. They can work in oral surgery, orthodontics, pediatrics. There's periodontists. There's other specialties like endodontics, which is root canals. So there's lots of different opportunities for you to figure out what you're interested in while you're in the dental assisting program and get a job working in that field. One of the students that I have right now just got offered a position at the University of Washington Oral Surgery Clinic. She hasn't even graduated yet, and they're already walking her through the application process. So dental assistants can work in private dental offices. They can work in community clinics, like Neighbor Care, Health Point, CMAR, hospitals. So we are just getting ready to start an externship with Seattle Children's Hospital in one of their specialty clinics, but we are already at Odessa Brown, which is a children's clinic in the Central District. And one of our students this year is getting hired at Odessa Brown, and they've hired many of our former students. And we work in a partnership with the University of Washington. So we also, and they do hire our students. One of my students last year got hired there. And so there's all kinds of facilities and places and spaces for you to work as a dental assistant. And it just kind of depends on what you like. So what does a dental assistant do? They can work in the laboratory. So if you're really good with your hands, dental assistants pour up models. They trim models. They prepare for procedures like setting up and breaking down. They use dental instruments by handing them to the dentist. And there's a lot of work that the dental assistants can do on their own with the tools. There's a question. Oh, yes, it's very versatile. Thank you, Tina. Is it? Yeah, okay. So dental assistants take x-rays, they suction, they do scheduling. A lot of dental assistants become front desk or office managers for the whole office or clinic. So we partner with Neighbor Care Health, and Neighbor Care Health, their director of operations was a former dental assistant in the company. And she went from dental assisting to patient coordinator. From patient coordinator, she went to like their whole department coordinator. And from there, she just recently became their dental operations manager. And so that was a pretty big step. She never increased her education past going through the dental assisting program. And she is now a very high up executive for Neighbor Care Health. Dental assistants sterilize equipment. They keep dental records by writing in the chart and putting all kinds of healthcare information in the chart. And they also order dental supplies. So here's a little video that just kind of shows some of the things dental assistants do. This is actually in our clinic at the Pacific Tower, so you can kind of get an idea of what it looks like. All right, so that's our dental assisting lab, and we practice x-rays there. The students were making temporary crowns. Those are crowns that get made after a patient gets their tooth prepped for a crown, and they practice those a lot. And so if you're really good with your hands, it's really kind of fun to get to design and shape temporary crowns for your patients. So the next thing is the educational pathway to become a dental assistant. It's a 1-year certificate program. It's 3/4 of clinical and classroom instruction. We have an internship that begins 3rd quarter, where you're actually working in a dental office or a dental clinic or at the University of Washington 2 days a week. And the 4th quarter, which our students are in now, is 4 days a week. And they only attend class in their 4th quarter. We're only meeting 4 times. And we just had our 2nd class session this Friday. We meet again on May 6th, and we have our final session on June 3rd as we're getting ready for our graduation. So the students are all getting really, really acquainted with the clinics or dental offices that they're working in, because they've been there since January. And so by the time they're completing their externship, they'll have been working at that office for 6 months. And that's one of the reasons why all the dental assistants have been offered employment, because they've actually been working with these dental assistants and this dental staff for 6 months. So I'm going to show you a video of what the difference is between a dental assistant and a dental hygienist.
Finally, y'all, I am in therapy. I've always heard people say that going to therapy was the best thing that they've ever done. And I'm like,
hang on one moment. I don't know where that came from. Oh, oh, okay. I don't know where that came from. Okay, hold on 1 second. Okay, let's close that out. Something on YouTube. Okay, let's try this again. Sorry about that.
Hey Tracy,
Okay.
this is Gurlal with the South IT. Let me know if you need any assistance.
Oh,
having trouble.
okay. I got the video going. I'm not sure. I had something else that was coming up on YouTube. I don't know if it was an ad or what, but I have it now.
Okay.
Okay, let me get.
Are you going to share a screen?
I'm going to. I've
okay.
got it.
Okay.
Thank you. Okay, that was fun. Okay. All right. Can you give me a thumbs up if you can see my screen? Awesome. Thank you. And hopefully I shared sound. Can you give me a thumbs up if you can hear the sound?
Hi guys, welcome back to Dental Vibes. I'm Carla.
And I'm Gabby. And today's video will be super short.
Yeah.
This video will be for anybody that's considering the dental field out there and they're not quite sure if they want to be a dental assistant or if they want to be a dental hygienist. So we're going to clear up some confusions and distinguish the two.
So the first thing is, number one, schooling is totally different. To become a dental assistant is basically just go where, you know, they're offering the program and you just go in, pay for it, and you get your certification. And sometimes there's a lot of dental assistants that have just walked up to a dental office. They're like, hey, I'm interested. And if they're able to, they will train you on the job. And then later on, you go and get your certification. However, for dental hygienists, totally different. You have to get your associate's degree, and during that time you get your prereqs, whatever the dental hygiene school is requiring. You have to get accepted, keyword, into the program. It's very competitive.
It is.
And I think it's about what, a 2-year full-time during hygiene school alone. So definitely way more schooling, obviously more expensive, a little bit more time. So that's point number one.
Yeah, so another thing that's completely different is the duties, right? So a dental assistant will assist the doctor with every procedure, with everything. Even will assist some hygienists as well. So cleaning up their instruments, suctioning for them. So we will assist and do everything in the office. Hygienist, on the other hand, all you will be doing will be cleanings, x-rays, and sometimes sealants. So your day will be cleaning, x-ray,
They have
some
like their own
sealants.
schedules separate from the doctor.
Yeah, so it's completely different when it comes to duties.
Yeah. Number three, a big one, the pay, obviously. Dental hygienists do more schooling, and so they make more money.
Just makes sense. More schooling, more money.
Yeah, so almost probably
twice as
much as a dental assistant, if not a little bit more. So there you go, big difference right there.
Okay, so the fourth difference is the scheduling. So the schedule of a dental assistant involves the dentist 100%.
Yeah.
So you finish whenever your dentist finishes. If the dentist is not coming into work or is on vacation, you're probably not going to work. As a hygienist, you have your own schedule. You have your own room. You pretty much have your own patients. So whenever you're done with your patient, you pick up your things and you leave. If the doctor is on vacation, you can still come in and do cleanings. So that's completely different when it comes to scheduling.
Yeah, so it's like they have their own flexibility to sometimes make up their own hours, work less, work more. It just depends. So there you guys have it. This is a very quick generalized video on what are the differences between a dental assistant and a dental hygienist.
Yeah, and we're not necessarily saying one is better than the other because they're two different positions. two different pays, two different schoolings. So it's really a personal choice, whatever you feel like you want to do. But we are assistants. We love what we do. Some assistants would say that they don't want to do hygiene. So that's totally up to you.
Yeah, and you know, you can always be a dental assistant first, and let's say you're like, oh, maybe I wish I would have done that. You can always go ahead, do the schooling, and graduate as a dental hygienist. So there's always that opportunity.
Absolutely. Okay, so don't forget to like this video. Make sure you guys subscribe to our channel if you like some more dental tips. Make sure you check us out on Instagram as well if you like dental memes.
Also, don't forget to leave us a comment below. Are you torn between being a dental assistant or a dental hygienist? Let us know, and we'll see you next time. Keep smiling.
All right, so I am going to stop the share and get back to my PowerPoint. I don't know if I should, because of our last little fun situation, I think I'm gonna just come out and then come back in. All right, let's go. I can never trust the link. That's fun. That's the fun part about that. All right, so here we go. All right, we're back. So that's the difference between a dental assistant and a dental hygienist. And again, I think a person with the iPhone came in a little bit later. I am a dental assistant and a dental hygienist both, so I can answer questions about both. So if you're interested in knowing about the pay, this information was taken in 2020. And things have changed a little bit since 2020, and I'll let you know how. It seems like after COVID happened, a lot of dental assistants couldn't go to work because everything was shut down, and because a lot of aerosol was coming out of the oral cavity, a lot of dental offices were only seeing emergencies during COVID. They had to shut down just like everything else pretty much, except for hospitals, but they were only seeing emergency patients. And I'm not sure what kind of happened, but a lot of people made a decision not to come back to work. And so after COVID, the need and the pay for dental assistants has increased tremendously. So currently, this is the average pay for a dental assistant just getting out of school. It's $25 an hour, which equals about $52,000 a year. Now, if you work for a specialty like orthodontics, oral surgery, periodontics, pedodontics, any specialty office will typically offer a little bit more in pay because they're a specialty. And so they usually charge a little bit more in pay, just like when you go get your wisdom teeth extracted and things like that. So their staff usually gets paid a little bit more. And if you, depending on demographics, if you work over in Bellevue or in downtown Seattle, that also increases your pay. Now, we also have another program within our dental programs that's getting ready to start in January. And that is called the EFDA program. And the EFDA program is the Expanded Functions Dental Assisting Program. So if you are a certified dental assistant, if you've gone through the dental assisting program, you can apply for the EFDA program. And what an EFDA can do, they can do all the duties of a dental assistant, but an EFDA can also place fillings and do restorations. And so when the doctor drills out the decay, the doctor can go on to the next patient, and an EFDA can come in and complete the restoration. Seattle Central College had the EFDA program a number of years ago, and we are bringing it back, and I'm extremely excited about that. So that is another option for someone who has been a dental assistant or has completed the dental assisting program. So super excited about that. And we have been having informational sessions. If you come on Monday the 2nd to our open house, our director will be there, and I will be there, and we can show you around and talk about the EFDA program as well. Additionally, the EFDAs have the same restorative license that hygienists have. So it's kind of a middle ground between a dental assistant and a dental hygienist. And so if you get into dental assisting for about 5, maybe 10 years, and you decide you want to do something else, there's multiple options for you to consider. So in order to get started for dental assisting, you just need to be eligible with English 98, math 87 or 91, and have a high school diploma or a GED. And there's academic advising that is also available. Now, let's just say that you've been out of school for a while, and I'm bad with math, so I understand that struggle. So let's just say it's been a while since you did algebra, maybe 15, 20 years, and you can't pass math 87. Well, we don't really have math in our program, so it's not that big of a deal. But we do have a program called iBest, and that program is available for any student that maybe didn't pass the math or the English course, and they come alongside you and give you support in any area that you need it. But the good news is that it doesn't deter you from still entering the program. And so I just found out about this program recently, and I'm super excited that we have this because, you know, why would you be like prevented from being in a program because of a math score when we're not doing math? Doesn't make any sense to me. So anyways, I'm glad we found this program. It was kind of by accident, but because I'm not a math person, I'm really happy that we have it. So if for some reason you get online and you don't pass one of those math or English assessments, please reach out to me and I will give you the information and who to contact to be able to still come to the program. So this is the end of my presentation. This is my direct contact information, and I will also put it in the chat. It is tracy.cook@seattlecolleges.edu. And again, I can't say enough. Is that next Monday? Yes, next Monday, pretty much the same time at 3 o'clock to 6 o'clock. We are going to be having that big open house. We're going to be having all sorts of people there at the college. And what's going to be really fun, if you're seriously interested in coming into dental assisting, we're going to take those students into the computer room and walk you through the registration process. So we will be accepting between 20, possibly 24 students this year for our cohort that begins in the fall. And I know for a fact that we already have 9 on the list. And so if you are serious about coming into dental assisting, I encourage you to open up your schedule and come out next Monday and come see me. Let's talk. And now it's your turn to ask some questions. I hope you got my email address. I'll be happy to give it to you again. I'm going to stop sharing my screen. And I see something in the chat. After completion of this program, do we need to give a dental license exam? So there's a CDA examination that comes once you've completed the program. This particular class that we have in right now, our class of 2022, is our very first class that is taking the CDA exam while it's included in our program fees. So before, the students had to pay $400 to take the exam. Now we've included it in our program costs. And so they are going to be taking the exam next month. And the good thing about having your CDA license is that a lot of organizations that you work at will pay you extra money for being certified. They also often pay extra money if you can speak 2 languages or more. So is there an assessment like the TEAS test required? The assessment's no, we don't have any of that. We just have the CDA exam that is at the end of the quarter and at the end of the year. And I'm actually on the Fridays that we're meeting right now. The students and I are spending 2 hours reviewing for the CDA exam. And I took the CDA exam in 2020. I wanted to get familiar with what was on it so that I could teach to make sure that the students had everything they needed to pass that CDA exam, and also because I let mine expire. So as a teacher, I needed to have it. How long will the EFDA program take to complete, and do we need to be working with a dentist? So the EFDA program is, I believe it's 3 quarters. And we will provide everything you need. I know prior to, there was something that said that you had to have a dentist mentor you. We work in a community clinic with several dentists, and it's my understanding that that's not required in this particular program, but you can get more clarity about that if you come to the open house from Dr. Partito. Yes, I'm a high school junior that's interested in the program. Do you think it's too early for me to apply? No, we have started our program with running start. So if you're a junior and you're going, the question is, will you be 18 before June of 2023? For the person that's a high school junior. Yes, okay. So if you're gonna be 18 before June of 2023 and you're serious about coming to the dental assisting program, I encourage you to come on Monday night. Make sure that you introduce yourself to me and let me know that you were on this tonight. If you can take there's a requirement that has to be taken for seniors, for their senior year. I think it's like a world history or something. If you can take that during the summer, because I believe that's your only requirement for your senior year, you can join our dental assisting cohort in the fall. And you can also consider taking those 6 classes and graduate next June with your associate's degree. And several of our students are taking prerequisites for dental hygiene, and they're also taking the courses to get their associate's degree when they graduate. We also have some students that are going into the bachelor's degree program, because we have a community health and education bachelor's degree program that we have a pathway straight into after you complete the dental assisting program. Let's see, I have a foreign bachelor dental surgery degree and I'm interested in the program. If you want to come on next Monday, you can go ahead and walk through the registration process at Seattle Central College. But if you don't want to come in, you could just go on the Seattle Central College website and click on registration. You have to get in. Thank you. I'll see you on Monday. Yeah, tell your friends about the EFDA program. All right, bye-bye. So if you want to go on registration and get started, because you have to create a Seattle Central College student number. And so that's the first step. If you want to come and talk to me personally or our director and kind of just share a little bit of information about where your degree was from and what kind of experience you have, we can also talk about that. I don't know too much about transferring degrees from other countries. Where can you get the information about Monday's open house? So if I can send you the flyer and give you an address. If you guys want to if you're interested and you want to put your address in the chat, I can write it down and I can send you the flyer with the address and everything. Okay, and yes, you can email me, that's fine. All right, got it. And I can email you both the information about the open house. All right, so are there any other questions about the program? Anything you'd like to ask, or anything about anything? I've been pretty much doing this for so long. Okay, got it. All right, the pros and cons of each, we have 1 minute of dental assisting. Well, I think, let me say this. If you become a dental assistant before you become a hygienist, you're gonna be typically usually a better hygienist because you have a bigger understanding of the world of dentistry. So dental assisting prepared me for dental hygiene, and dentists love dental hygienists that have been assistants because they're really good at x-rays and they know how to talk to the patient, and they're just more comfortable in their skills with providing dental care. Yeah, dentists just really quickly snatch up dental hygienists that have been dental assistants. I look forward to seeing you guys too. I wish I could see you, but it was really fun. So we have to leave the breakout room, but I'll see you hopefully on Monday.
Thank
Bye-bye.
you. See you on Monday.
Thank you.
Like getting a 75% or higher on the TEAS test. And there's also the GPA requirements. I believe it's 2.5
Yep.
on all of the classes.
We went over all the requirements, so we're good with all the requirements.
All right.
Just around, yeah.
How they select the cohort. Yeah. I have heard the lottery system as well, but I can't say for sure.
Yeah, me too. Okay.
Lydia, did you have your hand?
Yeah, I was just going to say, I know that a big determinant is getting